Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, welcome to the Longevity Formula podcast. I'm your host, Dr. Brandon Crawford. In today's episode, I'm thoroughly excited about this. I got to talk with Dr. Jeri Levine. Dr. Jeri is a good friend of mine. We've been working collaboratively on several different projects. She's been a business partner in certain other ventures, but she is a very well-respected mental health expert. She comes to us from Atlanta, Georgia. She is working in our office pretty much every month now here in Austin, Texas, on some procedures that we're going to talk about in this episode. But in this episode, you get to really know Dr. Jeri, where she's coming from, her background, which I think is very important. We also go into detail about how the mind, how our psychology can actually influence inflammation in our body, which was it's a very important topic to understand. So we're going to get into the details about that as well. We're going to talk about why it's important to acknowledge the mind-body component of healing. We're going to talk about our laser-enhanced PRP procedure that we've been doing for about a year now in the office, and you'll get to know the details about that. And we really start defining what we call precision therapy. You definitely want to catch the details on that. And then we have a little snip at the end where we go into discussions about cognitive evolution. Are we cognitively evolving or devolving at this point in time, which was a fun conversation to partake in. So I'm looking forward to it, and thanks for joining us. Hey everyone, how's it going? So I have one of my absolute favorite people on the planet with me right now. This is Dr. Jeri Levine. We have so much to talk about. We're going to try to stay focused on a certain very important topic, specifically an extremely exciting and very beneficial procedure that we've been doing in the office this year. But for now, welcome, Dr. Jeri.
Thank you.
I think what people really need to know is, who are you? Because you're an amazing person. You are a double doctor, Dr. Jeri, right? So could you just take a little bit and tell us a little bit more about who you are?
Absolutely. So I am based in practice in Atlanta, but I travel a lot. I now spend half my month in Austin, and I'm kind of all over the place. I work with a variety of different people. So the basis is psychology. The basis is getting the brain and the body and everything to work together in a way that we want it to. So sometimes when somebody comes in and we're dealing with emotional guilt or some kind of trauma, if they understand that that's the deepest pathway, that that's the strongest neurological pull, and that's the reason the mind starts down that slippery slope every time, it takes some of the guilt, it takes some of the anxiety out of actually changing that, and we're just going to make a deeper pathway. We're going to make a more positive pathway. And so by doing that, we just move some of that emotional baggage out of the way, and the rest of it gets easier.
That's beautiful.
Because we're just reconnecting.
Absolutely. And that makes total sense. And what you just described is really a big basis for neuroplasticity, right?
Exactly.
And so it's important for people to understand that neuroplasticity applies to every aspect of life, even the mind. And that's phenomenal. What got you started in this work?
Well, So initially, because things have changed so much over the course of time, right? So initially, my childhood was pretty difficult. And I just felt like growing up, if I had just had somebody who was in my corner, if I just had somebody I could rely on who would support me, not take care of me, but help me figure out how to navigate my life, it would have been so much easier. And so psychology was a great fit because I wanted to have that role. I understand what it's like to flounder and to not have the support and not know how to deal with things. And so it was an easy transition to, this is what I wish I had had, right? So that's kind of what got me started. Then 8.5 years ago, I had a traumatic brain injury and started that road and was in still pretty traditional medicine at the time. And I didn't have some huge scar across my face and I didn't lose a limb and that kind of thing. And so when I would go in for neurological appointments after the accident, they would look at me and I was clean. I was on time. I could use the appropriate terminology when we spoke.
Mm-hmm.
And so there wasn't anything wrong with me. And they'd
Images
say,
were clear.
yeah,
MRI was fine. Yeah.
yeah, so there's nothing wrong with you.
Right.
And I'm thinking, dude, I can't find my car in the parking lot when I leave a store. Yeah, there's something wrong with me. And I couldn't get anybody to listen. And so I attended a brain tap conference in North Carolina, and you spoke talking about laser therapy and brain and how we put it all together. And I looked at my business partner and I said, holy cow, these people would understand me. These people would get that I'm not okay.
Well, we still don't understand you, but we're getting close.
It's getting better. So that started me, and I'm lucky. I live in Atlanta. Life University is right there. They have a great neurological program, and started there. And then as I started to heal and really come back into myself, and it was really nice because conventional medicine, I was early 50s at the time. And I'm saying I don't have any memory. Like I can't remember if I don't take notes on a patient. I'm trying to run a practice. If I don't take notes on a patient phone call, I don't remember the next day talking to them.
Right.
That's not normal. And they would have the audacity to say, well, you are getting older. And it was like, wait a minute. No, that's not what this is. And so when I found functional neurology, and that made perfect sense when I talked to the doctor about that the first time, right? And so then as I started to heal, I thought, holy cow, this is where psychology needs to go.
Right.
There's got to be a body component to this. And so now, bless her heart, somebody comes in thinking we're going to spend 6 months talking about their mama, and I stick a laser in their mouth, right? Because if I can get to their midbrain and we can balance that out, they don't care what their mother's doing.
Exactly.
They can go on and live their life.
That's so important. Well, thank you for sharing that, because I know that story, while it has many tangents, is going to be very impactful for so many people, just to hear that even though your images are clear, tests are normal in quotations, there can still be something going on that's preventing your optimal self.
Absolutely.
Right? And I remember one of the first conversations I had with you, I believe it was after I spoke about lasers for the brain and this type of thing. And at the time, my audience was still primarily chiropractors. We would have some physical therapists and some occupational therapists, but you were the first mental health expert that was in the crowd that I spoke to. I know we had some, but you came up and you started asking questions, and I finally asked, who you were, where you from, what do you do? And I heard your background. I was like, why are you here, right? And not like in a way of like, what are you doing here? But in a way of like, what drew you here? Because, I haven't spoken to many mental health experts attending our conferences. And you said, I want to learn more. There is something missing in the field. And that was a huge aha moment. And that's why I fell in love with you. One of the reasons, right? Just one of the reasons, because you were willing to push the boundaries. You were willing to think for yourself. You were willing to think outside the box. And quite frankly, you had I don't want to say a problem, but you had something that you were trying to find a solution for.
I had a problem.
And that's what really drew me to you. And honestly, when I find someone in the field, in any field, that's willing to think outside the box and willing to do things that better others, it makes me feel negligent not to pull that person into anything I'm doing, right? Because if there's something that you provide that I don't provide, then we need to collaborate. Of course, if it's good for someone and it's safe and all those things, and of course, all those things check off for you, of course. So it's amazing. And I'm very happy to be able to, on this journey with you, share the passion with you. This has been a very, very fun, past few years working and collaborating with you. And you're right. The great thing is every year it's something different.
Yeah.
Innovation is fun. Imagination is fun. Of course, using the framework and the foundation of the current literature in neurophysiology and neuroplasticity, right? All of that to explain what we're doing and how we're going to do it, but then being willing to step out of the box and really look at how do we get this patient better instead of well, what is insurance going to pay for? Or what does the literature say I have to do? Or, right? That's a different mindset.
Totally.
It's a completely different mindset. So one thing that I definitely wanted to talk about was this procedure that we've been doing in the office. We've been doing it in Austin. Like you mentioned, you're here half the month now. We've been doing it in collaboration with our medical director, Dr. Marcella Madeira, who's an amazing individual as well. She is a neurosurgeon. And so it's great to be working with her, underneath her. But this is a laser enhanced PRP procedure, right? I've talked about it in multiple ways, but we've never really discussed a very important role that you play in the procedure and your work plays in the procedure. So let's kind of go down that road a little bit, if you don't mind. So do you mind? So let's first kind of just give the audience a little bit of framework about what this procedure is from a scientific perspective. And then we can dovetail into really what makes this so powerful in the inclusion of what we'll refer to as the mind-body perspective. Is that cool?
Yeah, that's great.
So do you want to start with
No,
that?
you start with
Okay,
that
okay.
part.
All right. So the way this works is we first draw the blood from the individual, right? So this is a simple blood draw. This is nothing crazy. It's just from the arm. And we draw the blood and we spin it into a PRP. And PRP stands for platelet-rich plasma. Now, within that solution, there's several things, several key ingredients, if you will. There's growth factors. These growth factors can be for just about anything. There's growth factors for nerves, neurons, organs, the various tissues in the body. There's also certain peptides that are concentrated in the solution, one of them being thymosin beta-4, TB4 for short. This is a very regenerative peptide. It does many, many things, very safe, very effective. And again, this is naturally found in your own cells. Another component, which is very exciting, is a type of stem cell called a VSEL, very small human embryonic-like stem cell. Now, this cell is not utilized very much in medicine or even in regenerative medicine right now because it's dormant. No one really knows how to turn this thing on. However, through the inclusion of a very specific calibrated laser, we're actually able to turn this stem cell on, and there are studies behind this. And so now we can activate these cells in a tube before we re-administer them to the person. Now, when we re-administer them to the person, this is another very magical component to this procedure, because if you look at the current stem cell research and you listen to some of the leading authorities in stem cell research, one of them being David Sinclair out of Harvard, he's a PhD geneticist, he will tell you that even if you inject stem cells, say, into your knee, the problem is still getting them to stay there, right? They're still going to want to travel throughout the body and heal whatever they can touch. So we use this same specific laser to then laser the tissue where we want those cells to focus. And what that does is it alters the surface receptor proteins in the tissue so that as that PRP solution that we laser enhance is going through the body, it's going to go through this area that we lasered, and it's basically going to create a sticky spot so that those cells then concentrate on the tissue that we want them to stay in. So a lot of what we've been working with has been very severe, complex neurological conditions. Anything from traumatic brain injuries, anoxic brain injuries. We've had dystonia cases. We've had severe autism cases. We've had, you name it. We've worked with some very severe situations. So if we want those cells to focus on a certain part of the brain, that's where we shine the laser. If we want them to focus on a certain part of the enteric nervous system, the gut, we shine the laser there, et cetera. So that's the sciencey part that is defined, it's been researched, and et cetera. But there's this entire different part, this mind-body component, right? That's very important. And you heard Dr. Jeri talk a little bit, kind of alluding to this work, but I guess let's first kind of give a little bit of information on what that looks like, what it is, and why it's important. Can you do that for me?
Yeah. So change is trauma.
Mm-hmm.
Whether you win the lottery or you get sentenced to prison, same part of the brain lights up.
Nice.
So if there's some kind of traumatic event, it's going to create an enormous amount of change. And we know research shows us time and time again that stress and inflammation are completely linked. And the more stressed we are, whether that's physical stress or mental stress, it creates inflammation in the body. An inflamed body doesn't heal.
Right.
And so my job in this is to lower that stress in order to lower that inflammation. That's the bottom line. That's all we're doing. And so there are a number of ways that we do that. When the body is calm and when the mind is calm, it creates a chemical homeostasis. So that starts to reduce the stress. It starts to reduce the inflammation.
Right.
And ultimate healing doesn't mean you can do a triathlon. It means that emotionally things work, and physically things work, and mentally things work, and hopefully financially things work, right? If we don't believe we can have, can we have, kind of thing, right? So regardless of where that block is or where that trauma is, my job is to get in there and figure out, how do we move that out of the body? There's all kinds of research on how our body holds emotions and how our body holds past events. Do some body work on a veteran who's been in combat. You know, you can trigger an episode sometimes because of what we hold on to. These kinds of traumas that we deal with, they're not any different. And even for somebody who's not been through a severely physical trauma, traumas stack up day after day after day. And we either deal with them and let them go, or we hold on to them. And one of the things I like about what I get to do in this part is we get to look at things that we don't think could even be related to the physical trauma. You know, sometimes I'll ask someone, you know, what were the feelings you had immediately post-accident or post-trauma, that kind of thing, if it's a patient that, you know, we can have that conversation. And my next question is always, but where have you felt that before, right? Let's go back and find the beginning of that pattern. Let's go back and see where that actually started. And sometimes it's with the trauma, and sometimes it's years before.
Yeah.
And so to be able to get to those places and move that stuff out of the body is super exciting to me, because I love to watch it leave.
Yeah.
And just creates a space for healing for them. And I think false hope is worse than no hope, right?
Yeah.
But you want the body in a hopeful state. You want the body in a state of gratitude. You can't be in panic and gratitude simultaneously.
Correct.
Right? And so if we can keep on that side of hope, if we can keep on that side of gratitude, it makes everything easier. And so my modalities are about how we get there and how we stay there. And I do a lot of applied kinesiology. So I do a lot of asking the body. It's really nice when I work with somebody. I don't need their whole history. I don't have to know about every horrible part of the accident. We don't have to walk back through it. I'm going to ask the body a handful of questions, and it's going to tell me what it's holding on to and what it's not. And we can just let it go. I mean, I don't have to start on, you know, you were born on a dark, stormy night, right? Because parents, especially in those situations, they don't want to have to wallow back through all that stuff.
Right. That can be traumatizing in and of itself.
In and of itself.
Yeah.
And so what's really cool is sometimes if it's a little person and not somebody that I can do straight muscle testing on or that kind of thing, I can use a parent as a surrogate, right, to do that body work. And then always when we're clearing somebody, I do my best to clear the other family members, because like the one we talked about this morning, he doesn't remember the accident,
Right.
but mom lived every moment of it.
Right.
Right? And so being able to clear that for her as well, not only aids in his healing, but hers too.
Absolutely. That's so important to realize that it's not always just about the patient. This is affecting the family unit, but then even beyond that, there's a huge ripple effect. I love that you brought in the conversation about the inflammatory markers, because there are research studies, multiple actually, that show chronic mental stress does increase inflammatory markers, interleukins, etc. So if you have this block, if you have this emotional event, conscious, subconscious, whatever, unconscious, right? That alone can be driving inflammation.
Absolutely.
So you can change your diet, you can take a medication, you can take a supplement, you can do whatever. But if you haven't addressed this part, you can still be inflamed.
Absolutely. Every physical event has an emotional component. Every
Absolutely.
one.
Has to, right?
And if we don't deal with it, then that's still in the way.
Yeah,
And that's just not a fence you want to jump over. It's one you want to plow down.
absolutely. Well, you have to in order to break through plateaus, right?
Yes.
So you're right. Like the patient we were talking about this morning, he wants to walk. He had a AVM, atrial venous malformation, ruptured, rather traumatic, lost the ability to walk. He's wheelchair bound. So in my initial discussion with him, I said, hey, we're going to set goals because if we're not shooting towards a target, we're just randomly shooting. So anything we do clinically, we always have a goal associated with it. And that's highly important in this procedure as well. So we were talking through his goals, and he started talking about wanting to walk, but then he started to shy away. He said, I don't want to overshoot, right? I don't want to aim for something that's not going to happen. And then mom reinforced it, right? And so that was a great event for me to go, wait a minute. No. We want to shoot for the stars. We have to actually, like, if we're going to break beyond limitations, this is what we have to do. Otherwise, why are we here, right? I'm not here for palliative care. Neither
Right.
are you. That's not what we're doing.
Right.
People come to us when they want to break through these plateaus, when they want to shoot for the stars. That's what we're doing. But if we're going to do that, we have to understand where these limitations come from.
Exactly. And you did such a good job with that with them. So when I got into their mind-body appointment today before the procedure tomorrow, and I went over a little bit what's going to happen and how this is going to roll, and then we got into, and I said, okay, I want to talk about goals. And before I could explain any of that, he goes, I'm going to walk across stage of graduation in May.
Perfect.
And mom took a really deep breath, and she reached out and she said, you will. So they really got it. I mean, they really took to heart what you opened up for them. And it makes my job so much easier because now we just going to go and fill in here's A and here's B and how we're going to get there.
Absolutely.
On the emotional end of it.
Exactly. But if you go to, I don't want to beat a dead horse, but if you go to your standard PT, your standard OT or what, and I'm not saying anything bad about those professionals. Love PT, love OT, love all the people. But that's not a goal for them.
No, it's not. Not in this case, for sure.
Yeah, and it's unfortunate. So one thing that's always drawn me to your work, and you alluded to it a little bit, is that we don't have to go through all this talk therapy. Talk therapy is important and it has its place.
It does.
But can you give a little more background on how can you work with someone, right? Even when you're working with the unconscious patients that we have, how is this possible? And I know this is a really complex topic, and I don't expect you to give a dissertation on it.
Okay.
But how can you work with an individual and navigate a case like this? You mentioned muscle testing, and I love it, believe in it. It's good. You have to be well trained in it. You are. How does that work? And what can we expect from it?
Okay. So the body's got all the answers, right? And here's the thing about talk therapy. If you have 3 brain cells, you can talk your way around a therapist all day long. And even the whole idea of you have to want to be well to get well. I get that. And even those of us who have the best intentions, that's still hard sometimes when we get into our own stuff.
Right.
Right. And so the reason I like going through the body instead is because it won't lie and it doesn't have to tell you this whole long, sad story. I can have somebody. So for example, with a patient this morning, one of my favorite applied kinesiology techniques is called, injury technique response. So what we're doing is we're removing that block that was created by that event. And sometimes that's really clear in somebody's mind and sometimes it's not. Like, for example, this morning, he doesn't remember any of the accident. Well, his body does.
Yes.
And so he doesn't have to go into an anxious state about, I don't know what happened. And his mother get all upset about, well, I know exactly what happened. We just ask the body. So we make sure the system's clear and turned on. And then we find a good muscle that we can use as an indicator. And when something is a yes, when something is positive, then that muscle is going to stay strong. And when there's a conflict, when there's an impasse, when there's something going on, and I push on that muscle, it's going to be weak. And it's so fun to do with people because we always start with, a lot of practitioners start with, give me a yes, give me a no. And I think that we have, as a society, so many preconceptions about yes and no and what they mean for us. So I always think of something happy, and we test that muscle. Think of something sad, and we test that muscle. And typically on the happy, it should stay strong, and on the sad, it should go weak, right? And then pull them back into think of something happy, right? Come back.
Right.
And then I have their yes and no. I know what the body's telling me then, and then we just kind of start looking at where can we get in and how can we make a change. And I know you may not agree with this, but I tell everybody this is actually what happened. That when we first started working together and you said, I'm going to send you this family, you said to me, I want you to do all the weird stuff, but don't start with the weird stuff. Start with the normal stuff, get them on board, and then do the weird stuff. And I don't think I said it out loud to you at the time because I really wanted to work with you. But I thought in my head, I don't have time to do the normal stuff. We're going to just jump into the weird from the beginning.
Right.
And so that's kind of how a lot of this looks. But when I can show somebody that their body knows what they're thinking, or even what they don't want me to know they're thinking, it just makes it so easy, and it relieves so much of the stress. I use a lot of applied kinesiology because I want to make sure that I'm in line with the body. And I also like the applied kinesiology because I can use a surrogate. If you've got a little baby, they're not going to hold their arm out for me so I can muscle test them, right?
Yeah.
But mom or dad usually works, kind of thing. And that just gives me a gateway into that. We also use, sometimes talking is appropriate.
Yeah.
Right. And so we'll use some talk therapy. We'll use some techniques. We do visualizations. It's really precision. It's like precision therapy. We're really finding out exactly what that brain needs, that body needs, that emotional body needs in order to heal. So a typical appointment isn't really a thing because everybody's a little different and we do them all a little differently.
Yeah, which is important. I love the term precision therapy. That's phenomenal. We should continue to run with that.
Okay.
Precision therapy. This is fantastic. And I love muscle testing. I used to do a whole lot, and then my mind started to kind of cloud it, right? I started to think, well, this person must be anemic, so let me muscle test it. No, wait, I don't agree with that. So I love it, but I have to acknowledge that sometimes I'm not the greatest one to do it, right? And so you've had way more training in it than I have. I think you do a much better job of staying clear-headed than I do. And so that's one thing just to let the audience know is that there are experts that are specifically trained for this. And there is a methodology to this. And one thing to kind of think through, just to kind of maybe help to understand this a little bit more, is if someone were to shoot a gun outside of the room right now, we would all have a physiological response. Our pupils would dilate. Our muscles would engage differently.
My head would hit the ceiling.
Exactly, right? So a trauma inside the body is just like that. If you're asking happy and sad, right? If you ask about something that's sad, it will generate a physiologic response in the body, right? It can be a muscle. We can look at pupil dilation. We can look at so many things. This is not pseudoscience.
No.
This is fact. This is neurophysiology. It's just another way to examine the body and get better, more precise answers. Because you're right, if you have 3 brain cells, you can talk around a therapist. And unfortunately, that person that you're talking with, they want to make the therapist happy, right?
Absolutely. Typically.
Or they want,
Or they don't.
That's a big tangent. Oh man. But yeah, so I love this stuff. This procedure that we're doing, there's good science behind it. We're continuing to improve upon it. There is something exciting going on right now where the FDA has been looking at this and following a child that had a genetic brain disorder. I can't give all the details on it, but the FDA liked what they saw, and they're getting really good. We're getting really good results with the kiddo right now. And there's talk about the FDA actually wanting to fast track the procedure for pediatric genetic brain disorders. Again, it will be a specific one. I can't give the details on which one that is right now, but so there is good science behind this. And there's, like I said, the FDA is looking at this. This is a good, very innovative procedure, which is a good place to kind of dovetail into a discussion on safety. So one thing that I want everyone to understand is that the safety of this procedure is extremely high. You heard me talk about what we do. We only use the person's own cells. We're not adding any kind of medication. We're not adding in anything foreign to the body. Like we talked about, we do work with some very severe, complex conditions. And sometimes that requires a very high skill level to actually use a needle because we do need that blood draw. And then we do have to re-administer the solution. So in certain situations, we literally have a pediatric anesthesiologist come in to just do the needle work. That's how serious we take this procedure. We're going to operate at the fullest capacity to ensure the highest degree of safety that we can possibly administer. So I guess let me ask you this. Is there an importance, or does it matter if we bring in the mind-body component while we're using the laser on the cells and while we're re-administering the solution? It's a weird question, but you know where I'm going with this.
Yeah.
So does it matter? Are we imprinting the cells? Are we doing something else to those cells? And I know this could go anywhere from Dr. Emoto's work to, all kinds of different directions, but that's how we do this, right? This is not, initially it's done separate, right? They work with you, they work with me, but then when we all come together, there's this event that takes place.
It's like that's where the magic happens.
Exactly.
Don't you think?
Yes.
Because you've primed them and I've primed them and the cells are now primed. And so it all comes together in this crescendo of healing.
Mm-hmm.
So absolutely, the emotional part to me is just as important during the procedure as it is in our time we spend before the procedure, because I want every cell in a state of equilibrium. I want a level of homeostasis that allows that laser and those activated cells to go exactly where they're needed the most, right?
Mm-hmm.
So when we use the frequency music in the appointment, when we talk about visualizing, when that either the patient themselves will read the list of goals that we've come up with, or a parent or family member sometimes will read that list of goals. And we always record that because when they're doing their post-procedure work, I want that continually to imprint. I want that to activate those cells, because I think as much as the laser activates, I think the emotions do as well. And so I just think it's one more way to pump this up. It's one more way to get in there. And then as they're going to sleep at night, if they lay down to take a nap, first thing in the morning, if they just continually listen to those goals that were recorded in that moment when it all came together, I think it's another powerful piece that makes what we're doing so special.
Absolutely. It's like we're re-advising the cells what they're supposed to be doing, right?
Yeah.
Because once those amazingly refreshed, recharged cells go in, it's like an army going in with their instructions, what they're supposed to do. And then they hit the battlefront and some crap hits the wall, right? They come up against all those emotions. They come up against all the inflammation and they go, oh my goodness, what are we doing, right?
Yeah.
And so it's good to remind those cells as they're replicating, as they're turning into other cells, as they're starting to do all these things, right? It's almost like we're sending in the instructions again, right?
Yeah.
It's amazing. It really is. What about limitations? Do you think there are limitations to this procedure right now? We talked about safety, but this is where it gets exciting. What do you think when it comes to limitations to this procedure?
Okay, so when you first started telling me that you were doing this, I was like, I don't know.
I'm learning a lot about you.
Maybe. I know, right? So I was like, I don't know, maybe, I guess, I don't know. Let's find out a little more about this. So before I started working with you on it, I came with a family that I work with.
Mm-hmm.
And they had a brilliant attitude, which was, if we get something out of this, that'll be great. And that was the reason I was willing to, to come and do this with them. And let's just see what happens. And it was different for me. I don't know about you. It was different for me because most of what we had talked about were really physically traumatized people,
Mm-hmm.
children and adults. And not so many that I know of at that time where we were really wanting more of the cognitive, more of the emotional, more of that end of the spectrum. Physically is great.
Mm-hmm.
So when we did the procedure and afterwards, so that was in May. And so when we did that work, I was completely blown away. And the first thing I learned was I hadn't set my goals for him nearly high enough. That I got to work on some of my own limitations and some of the places where fear will have me pull back, not just personally, but in therapy as well. And so, I mean, he went from writing, goals on his own before that, where we had been working, like, what are we going to work on this week? What are the things, because we're working online. So what are we going to do this week? How are we going to, what are our goals for the week? And, I mean, I would get goals from him like, well, I want 3 candy bars, or, I want to do what I want when I want, those kinds of things. And by June, I mean, he's sending me goals. I want a better relationship with my parents. I want my father to understand me. I want to learn how to not lose my temper every time I don't get my way. We've done another PRP since then. And now, just in the last couple of weeks, goals are, I'm really having trouble learning how to forgive myself. And this is, we went from such a 3-4-year-old mental narcissistic place of everything revolves around me to, I thought this is somebody that would never take responsibility for anything
Mm-hmm.
he had done. I just didn't think that was something we were going to get in this lifetime. And now I'm getting, can you please help me learn how to forgive myself faster? This is taking a long time and it's uncomfortable. And I don't like being upset with myself. And I don't like when I respond negatively. And I mean, he's using age appropriate or adult appropriate verbiage and communication skills when 6 months ago, it was like, I just want a candy bar.
That's
so
amazing.
I have learned so much in this process just about the whole idea of goal setting.
Right.
Right. And the thing I think I like the most about stretching those goals is that we get to work on all the things that get us there. We get to work on what motivation means to me, and we get to work on what's really important, and we get to work on those other hidden places that we don't like to look at, and we get to deal with the shadows.
Right.
And that's what health's about.
Absolutely. So the limitations reside within us as therapists, and it resides within the mindset of the patient of what is truly possible.
Right. We're fear-based creatures.
Absolutely.
The reason we're sitting here is because our ancestors were smart enough to not be eaten by a predator or set themselves on fire. Right?
I can agree with that.
Okay.
Yes.
So that's going to come up. That fear stuff is always going to be there. It's part of our alarm system. It's getting past that and knowing what's appropriate levels of fear and then what's just holding us back.
Yeah, absolutely.
And setting limitations that we've created. You know,
Yes.
that whole thing about there's, if there's a light at the end of the tunnel, but luckily it's not a train kind of thing, right?
Right.
Well, maybe there's not a tunnel. And
Right.
if there is a tunnel, we created that tunnel.
Fantastic. That's awesome. That's a good little segue. Do you think, and this is not unrelated to what but whatever, I want to ask you anyway, because it's something I've been looking at. Are we cognitively evolving at this point? Are we cognitively devolving because of the social systems that we've implemented and the technologies that we think are so amazing, and the screens we're in front of and the fluorescent lights and all the things? What do you think about that? It's an open-ended question, but one I wanted to ask.
Wow. So change is evolution, right?
Yep.
So we're evolving because we're
Okay.
certainly changing.
That's
if you look at a brain scan 20 years ago, there was no this swipe movement, right?
Right.
And now you can see that
Yeah.
in a scan. So we are totally adapting to our environment and changing. And are they all great? Are they all positive? I don't think so. However, here's where we are,
Yes.
right? And we have to make the most of where we are.
Absolutely.
So
That's a phenomenal answer, because I've heard some people who I really revere and think are extremely intelligent stand on this stage and say we're cognitively devolving. And I understand the perspective, what he's talking about, but you're right. When the human brain is placed in a certain scenario, it brilliantly begins to adapt.
absolutely.
And just because we're currently stuck in this adaptation, because these changes have come so quickly, does not necessarily mean we're devolving,
I don't think so.
right? I love your answer. Well, that's amazing. I mean, I think we've hit all the main points of this procedure and gotten to know you a little bit. I know I got to know you a little bit better. So I just want to thank you again. Thank you for your work. Thank you for the person that you are and for helping so many people. It's hard for a day to go by and for me not to talk to someone that's been affected positively by you, just so you know. So again, thank you for everything you do, and thank you for your time today. I really appreciate it.
I appreciate you. Thanks for having me.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandоncrawford.com.